if you've got nagging pain on the inside of your knee, maybe from a meniscus tear on the medial side, a medial collateral ligament strain, or just wear and tear arthritis on the medial side, which is more likely to happen, again, more in females than males, although medial side is more common because of that Q angle that puts more wear and tear on that inside of the knee. Don't just rush to injections or surgeries quite yet. The right knee brace can offload the pressure, stabilize your joint, and keep you active. In this video, I'm breaking down the Bauerfeind GenuTrain S Pro, why I recommend it, how it works, and who it's best for. Like PRP, like bone marrow aspirate concentrate, not all braces are created equal, and this one's a standout. I'm Dr. Tammy Penhollow of Precision Regenerative Medicine. Today, we're talking about the GenuTrain S Pro. Bauerfeind is something I am not affiliated with in terms of getting kickbacks. If you do use the link to purchase Bauerfeind, then I would get an affiliate, but you don't have to use my link. You can do this on your own. But here's something that I've noticed over the time. A lot of these knee braces can be big and bulky and hefty. A lot of them are so uncomfortable you can't wear them under clothes. And they also cause a lot of itching. There's the material that is extremely sweaty. This is not it. This is not for your everyday person. This is something that is a step up. Remember, we talked about KT taping for one. We talked about the Incrediwear slide-on sleeve for another. This is a whole nother level because it's got a stabilization bar. I'm actually going to demonstrate the brace, and I think it's important to look at it because it is a little bit different. It's not, again, a one-size-fits-all. You have to do measurements. You do measurements above the knee, and you do measurements below the knee, and these are at very specific places. It talks about the number of centimeters above and below, and then it comes in different sizes. It comes for left versus right, and that's what makes it special and customizable. However, it's not one of those $1,000 braces that you also often will see in an orthopedic surgery office. It's nothing that would be as restrictive as for, say, an ACL repair where you've got a brace going from your hip all the way down to your ankle. This is not it. This is a special niche, and it's where I see most of my patients that have a meniscal tear on the medial side. It's got a medial collateral ligament strain, or it's that wear and tear arthritis on the inside of the knee. So this is the medial collateral ligament. This is the medial meniscus, and this is where we get more wear and tear on the medial side due to the Q angle, which puts just more force or vector from weight from osteoarthritis. So we need to gap that joint. Look at what's happening here. If I gap the joint from the lateral side, it opens it on the medial side. I'm going to be very much explaining this over, but to exaggerate that this is gapping of the joint here to open it up, take some strain off of this so that if we've done an injection into your meniscus, into your medial collateral ligament, if we've done some work into the femur itself or into the tibia itself for advanced osteoarthritis, we've gone into the joint itself, that then it is not putting that major pressure and that squishing out of everything we just worked so hard to put in. It's great for rehabilitation. It's great for then using for the first couple of months after your injection therapy. So let's take a look at the brace itself. It has a little donut hole cut out here for the patella. It does have a stabilizing bar here. It does have a stabilizing bar here. There is a screw that you can adjust here. So I'm going to slide it on and show you. I'm going to lower the table for that. It does just slide on. I'm going to loosen the Velcro initially, and that's going to make it easier to do the tightening when the time comes. I've come down, and I'm going to tilt this down. Just going to take and slide on. Place this up on the spot where I would get the patella in the midline here. Got plenty of room. I'm going to tighten this up here. Tighten on the outside. Tighten on the outside, both front and back. So I need a little bit more on the back side here. And I do this with my knee in a bent position. Sorry, I should have said that before too, that I want my knee in a bent position because then when I straighten it, it's going to allow it to stay in a position here. So here it is from the medial aspect. Here it is from the lateral aspect. Sorry, bringing it back in. And it's just providing no restriction here. I can still fully extend, fully flex, and I'm not having any problems with that, but it is stabilizing the knee specifically at that medial side. It's gapping. And you do that by making any adjustments here at the lateral aspect to gap open the medial aspect if that's where the pain is in your knee, is on the medial side. So the benefits of this one again are that it is easily washable, hand washable. It is also easily placed in a gym bag, or it can be worn over under your clothes. It's not unsightly. I can easily pull my scrub pants back down over it, and it's not going to be a problem here. You're not stuck in things like tights or leggings. It's very comfortable, and it doesn't have any metal on the outside that's going to then cut your pants. It doesn't show, I mean, obviously you want to have a little bit of room in your pants so that it'll come down over it. If you are going to wear it in the winter, then you may want to put running tights on, then this over the top of it, because it won't fit over running tights. But the good thing about this is it's adjustable, that it is customizable. There are multiple colors, that it is very much to your size. So I do recommend doing the measurements correctly, where it talks about having your knee bent at a 30-degree angle, measuring up from the top of the patella or the kneecap for that upper measurement, and measuring down from the patella for the lower measurement. And that will make sure that you get a comfortable fit, and it will offload your meniscus. It will offload the medial aspect of your joint and allow you to do more activities with less pain, less likely then to create the inflammation and the swelling. So again, I've had patients that have sworn by this brace. Initially, a patient is the one who introduced me to it after I tried a couple of other braces for them during the trial and error of doing something like a PRP injection, or we'd done bone marrow into the knee with some bone marrow into the femur bone, bone marrow into the tibia bone, and bone marrow inside the joint. And then I wanted to offload them, but didn't want to put them on crutches because you can get some issues there. Didn't want to put them on a walker, but this medial unloader was very comfortable. A lot of the medial unloaders are not comfortable. A lot of the medial unloaders are very expensive because they say that, oh, we'll bill Medicare, we'll bill your insurance. And you look at the price that they're billing and it's in the hundreds and hundreds of dollars. And this one is not. So it's been a long time coming. I said that I would do one on this brace, and this is it. If you've got any questions, please comment below. If you like what you see, like and subscribe. You'll get lots of information on how to take care of yourself, how to harness your body's own healing ability to reduce your pain, reduce your inflammation, and get you back to those activities you love. I'm Dr. Tammy Penhollow, Precision Regenerative Medicine, to your best health.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.